Running an ambulatory practice today isn't simple. Leaders are balancing patient care, staffing pressures, financial performance, and rapidly changing technology all at once.
Welcome to In Practice, a podcast focused on the latest in ambulatory care, what works, and what leaders need to know to help their practices thrive. Hi, I'm Dr. Bob Murry, the Chief Medical Officer for NextGen Healthcare, and this is In Practice, a podcast where health tech leaders, clinicians, and practice administrators discuss the challenges that ambulatory healthcare faces every day. Recently, the Center for Medicare and Medicaid Services, CMS, announced the first round of funding under a new 5-year $50 billion, that's with a B, $50 billion rural health transformation program with funds allocated to all 50 states and administered by 50 different state programs. And while the scale of the program is really significant, a lot of providers may be trying to figure out how is it structured? Can any of this money be for me or for my practice? And how does this whole thing, what does it mean for my organization? And so with me to discuss that today is Chris Emper. He's the Government Affairs Advisor here at NextGen. Chris has been closely tracking the program like he does all things governmental, and he's here to help us make sense of how providers can navigate this and maybe get access to some of this fund. So Chris, welcome to the show. Thank you so much for joining me.
Thanks for having me, Bob.
All right, let's start with maybe the basics. Why don't you tell me about kind of where this rural healthcare transformation grant, what's the story behind it? How did it get approved? What was the idea behind that? Because I think some of that background is actually important to know for people that might be interested in accessing this money.
Absolutely. So it did not appear out of thin air. This traces back to last summer, and if you can remember back that far, when they were debating the reconciliation bill, the President Trump, what became titled the One Big Beautiful Bill that had the tax, the spending, the immigration, all the different provisions jammed into one that was ultimately a lot of fanfare back and forth. It seemed like it wouldn't pass at some point, but ultimately it was passed and signed into law on July 4th of 2025. And the bill was not a healthcare bill. It was primarily around tax and spending provisions, but it did have a group of several dozen Medicaid provisions that resulted in, over the next decade, which is how they score things with the congressional scorekeepers, projected to reduce Medicaid spending by over $1 trillion, so $100 billion, on average over 10 years over the next decade. And there were some concerns on this on the Republican side of the aisle, and this bill was passed over the objections of the Democrats with Republican-only support, championed, of course, by the White House and President Trump. But the objections when it was coming into pass were around the Republican side, around specifically rural hospitals, but other rural healthcare providers like community health centers, behavioral health providers, those in the social safety net that had Medicaid-heavy populations that might suffer as a result of the law. So in the last minute, as they were negotiating this, they inserted this fund. Originally, it was going to be called a hospital fund. There was some confusion. It's not restricted to hospitals. It's rural providers at large. But it was put in there for the first 5 years of the 10-year law. Starting this year, there would be $10 billion per year dedicated to rural health. And as tends to be the case, Congress passes a law and they put some guardrails around what's in it, but they punt all of the specifics over to the agencies, in this case, CMS, to actually implement it. So that's why you see the press release late last year around CMS actually announcing this program before the end of the year and implementing it. But it all traces back to that law and was intended as a bit of an offset for the projected and coming cuts in Medicaid spending that are part of that law.
So the Republicans were sensitive to the fact that there was a lot of Medicare and Medicaid specific funding that would be changed with the Big Beautiful Bill. And so this was kind of to help offset some of that. It makes sense. So it sounds like a lot of money, right? But how is it actually administered? Like, what does it mean for a provider in a given state?
Yeah, great question. It's been kind of confusing, and this came pretty fast. The law was, sometimes it takes 10 years for a law to pass to when the provision actually, hits providers, hits the industry. But again, this law was passed in July of last year, and the law said that CMS had to run an application period for the states and then administer the awards for all 5 years of the program by the end of last year, so the December 31st of 2025. So what they did, they rushed out an application to the states. The states, each of the 50 states, no No DC included here, but each of the 50 states are the primary grant awardees under this program. They each had to submit an application to CMS by November of last year, the beginning of November. Included in that, they had to put together a rural health grant transformation program in their state, how they were going to use the funds, what they were going to use them for. They had some specifics in the notice of funding opportunity, but a lot of leeway for states to create different programs and different usages of the funds. And then ultimately on December 29th of last year, just before the new year, CMS announced that it had made awards to each of the 50 states. All the applications were approved and that funding would start flowing the first of this year. So subsequently, January of this year, there was a kind of a secondary application period that the states had to go through with CMS to get their funding approved. That ended at the end of January. Right now, in the middle of February, funds should start flowing pretty soon, and there should be open to the recipients of them. But for providers out there, it's important to note that the states were the primary grant recipients, so providers cannot go directly to CMS here. Providers can go directly to their state's programs under this and potentially have access and gain access to funds under this program. So like other federal programs, it's not a direct grantee, but providers can be sub-grantees from the states who are the direct grantees under this program.
Got it. So yeah, all 50 states applied for the funds and they all got it. I know there was actually a lot of controversy about how the $10 billion that was allocated for this year was allocated to the different states based on factors that were maybe a bit confusing. But let's not necessarily go there because it doesn't matter at this point for the providers in any given state. If as a listener, you happen to be near a computer, I encourage you, there's a couple of links in Chris's blog on this that are helpful. So you can just Google NextGen Healthcare blog, and near the top, you'll see Chris's a short blog article on this. But within that article, there's some links to information about your state and the priorities, in many cases, that it put forth in its application to CMS for how it intended to use this money. And then depending on the state, there may be even more information about how to apply or what would that process would be or how you can stay informed in your given state. And so even perhaps if you've never applied for a state grant before, I think that this is worth a look. Chris, I don't know if you agree, but is this like only for rural providers? What is even a rural provider? Can anybody apply for this money?
Yeah, it's a great question. So it's a little bit confusing given the name of the program, but the funds are not actually restricted to rural providers and they're not actually restricted to providers, period. There's depending on how each state, and it is 50 different state programs like Medicaid. So each state has their own program. So I think my first advice to providers would be, if you're in one state, look up your state's program. Kind of ignore the federal press release on this because none of that information will ultimately impact you. Every state is going to have a website that lists how they're planning on using the funds and maybe have their own portal there. But look up what their program looks like, how you might benefit from it. Sometimes there will be opportunities where organizations will be given subawards from the states. As a provider, you might be able to get sub-grant awards from them. Some things around technology infrastructure, care delivery, redesign. Part of what they're trying to do in rural areas is figure out care design and payment models that work. Obviously, it's very different in a suburban or an urban area as compared to rural areas, and that's very much the focus of the program and what they're trying to accomplish here. So I think first and foremost, take a look at each state's website. If you happen to be in an organization that is in multiple states, my apologies, but take a look at multiple states' websites there, and then start from there and try to see exactly how this might apply to you.
Yeah. So, like in your blog post, Chris, you had just as a pick a state out of the hat, I think is what you did. We looked at North Dakota's, website that was describing this. And, the first page there gives a kind of an overview, and there's a link there for how providers or practices in North Dakota can stay updated around this topic and how North Dakota will distribute those funds. And then there's a funding opportunities stage, and then you go here. And again, this is specific to North Dakota, but a lot of these are kind of similar at a high level. And they intend to use the money to help rural and tribal communities within North America, but not every state says this, They want to help them strengthen and stabilize the rural healthcare workforce. They want to make North Dakota healthy again with preventive care and eating healthy. They want to bring high quality healthcare closer to home. And they want to connect technology, data, and providers for a stronger North Dakota. And so I can imagine all kinds of projects or things that providers or practices might be able to apply for. So, I mean, Chris, if you were in North Dakota or you were advising a practice in North Dakota, what would you have them do next?
Yeah, so I think if you haven't been tracking the program yet and you are interested, again, the website is the first primary source of information. But then start to look at the objectives they're looking at and then the actual notice of funding opportunity. Some of them have not released their portals yet and their application cycle. I think it'll probably happen for most in March, April, and May. When, as a provider, if you already haven't been engaged in that process, you'll have the opportunity to potentially apply for funds. But again, I'll go back and repeat, for the fourth or fifth time, but it is most important here to understand each state has their own program and their own requirements. So that really is paramount to understand. But many of the things you just mentioned that you can see, and I'm also looking on North Dakota's website here. Eligible activities. The states are going to provide payments to providers, consumer-facing technology solution, IT upgrades. Helping rural communities optimize healthcare delivery system, evidence-based prevention and chronic disease management. So all the things around health IT infrastructure, interoperability, telehealth, all those things, value-based care, disease management, prevention that we've been talking about for the last decade as, longstanding bipartisan reforms in healthcare are things that this program is trying to get at. So if you're in any of those programs or interested in those initiatives, and every practice pretty much is following down that path in some way, definitely worth taking a look and seeing how you might, fit into their specific plans and be able to match into their grant application.
And if you're like a smaller practice, or do you recommend should you join with other practices and apply together, or should you, get your local politicians involved? I mean, obviously it's going to depend on every state is different, but what from a practical level, like how, if you've never done this before, even if you have, what would be different about this one?
I'd certainly recommend staying away from your local politicians as a first example. But I think I would definitely say industry like trade associations, but also specialty associations. If you're a community health center, your state primary care association or consortium of FQHCs. Similarly, behavioral health, there's a lot of behavioral health providers in rural communities. They all have their own state societies, and then just your own state board of physicians, or, they all have their own resources that are tracking these things at the state level. So I think and every physician group is already largely, plugged in, or someone at the organization, whether it's in the front or the back office, is part of those organizations and is dealing with them on other issues. So I think connecting with them through that way and just expressing an interest in the program and potentially wanting to take a look at it is probably a great place to start. They've probably already done the legwork. And if you're in a smaller practice who doesn't have folks like myself or sitting around reading these thousands of pages of regulations, pay attention to this stuff, those groups likely do have people who have been tracking this since the application was submitted by the state late last year. So they're probably in a very good position to provide you the guidance you might need to take advantage of the program over the next few months.
Yeah, thank you. And I'll take a moment to put a plug in for our Health Reform Simplified series at NextGen Healthcare, which does help explain, changes in regulation and what impact they have on practices and ambulatory care. And this topic was discussed briefly on that a while back. So it sounds like the funds are not available yet, and it's obviously state dependent. But your rough idea of the time frame was that people need to get on this because the application process, if it's not open already, will be opening for most states pretty soon. And then when would you expect them to actually award money?
So again, a little tricky with the awards. Technically, from a legal standpoint, have been made to the states, but the money is sitting in some government grant account where the states can't draw it down yet until they get a secondary approval from CMS. That approval from CMS is supposed to happen by the end of February. So technically the states have the money and they can spend it all theoretically I believe by March 1st, but then states will spend it as they see fit and as fits in with their program and the applications they get for use of the funds over the next few months. Important to note, though, this is a 5-year program, and we're right now in the first year of that, and they could change year to year, and they operate based on the federal fiscal year here. So these funds will last through the fall, and then I believe October 1st, we'll start the next year in the program. So there's an opportunity then for another tranche of funding with potentially different applications of the funding and sub-grant opportunities come the fall. So again, even if the state has not opened up that application period, certainly makes sense to investigate what's happening, reach out to people to see when it is, so that you'll be prepared when that does happen. And you never know. It again depends and varies state to state. But sometimes the application they're looking for is quite lengthy and requires a lot of different compliance, other documentation and things. And you as an organization want to start that process as soon as possible so you can put yourself in a position to know whether or not it's something you can, go after.
And just, put the money in perspective, right? There's $10 billion in 50 states. So again, there was controversy into how it was allocated, right? But that's a couple $100 million, right, per state that's going to get awarded here. So some serious money and definitely worth looking into. I'm curious, Chris, if you have any thoughts, like back to the origin of this act and these funds. It was awarded to try to help offset some of the decrease in Medicaid funding, which came from a number of places, but a big one was just changing or forcing change to change a little bit, who qualified for Medicaid. But it doesn't sound like these awards are necessarily directed at directly addressing that problem or moving the money towards that. Is that how you understand things, or do you have different thoughts?
So the important thing to understand about the law, the One Big Beautiful Bill, and the Medicaid provisions, none of them came up, across the top. Of course, Medicaid is 50 different programs, but none of those provisions came across the top and said, we're just going to reduce Medicaid reimbursements by, 15%. What they did is they changed the rules around Medicaid enrollment and eligibility. The biggest one that's projected to have an impact is the work requirements, so that over time you would see a decrease in Medicaid enrollment, which as a provider, if you're a provider in a Medicaid heavy patient population area, you would see a reduction in your reimbursement there. And especially in rural hospitals where you have a lot of uncompensated care, community health centers where you treat a lot of uninsured patients, that's where these funds are intended to come in. So the provision was inserted as a way to try to offset some of that negative impact for the providers who truly are the safety net in those rural areas.
So, there's a $50 billion over the next 5-year a grant of money from the federal government to all 50 states. They have to apply every year, but presumably they will all continue to do so, and they'll all be awarded some money, which they in turn can then use to accomplish their strategy, their rural healthcare strategy, or whatever it may be in the individual states. It is very possible that many of the providers and practices out here listening to this would be able to at least apply for some of those grants because they would be seeking funds that would be in alignment with the strategy of their own state. So we would encourage them to go and learn more about the program and sign up and find their state website and see what types of programs those states are interested in funding and how would they start to do that, and that the funds will, obviously varying by state, but be available relatively soon. But the grant process for some states is easy, for others it's a little bit more onerous, and we recommend they start early. So that's kind of my summary of it. What did I miss, Chris?
No, I think that was great. I would just to put a pin on it. Industry wide, costs continue to rise. Inflation remains a problem. It's tough to run a practice. It's expensive to run a practice. Reimbursements remain, flat to essentially moderate increases or declining. So there aren't too many pools of funding that are specifically dedicated to offset some of what's happening. And especially when you consider the broader federal context, if you are a provider that has a Medicaid heavy population and you're concerned about the impacts of this bill, this fund was specifically created to offset some of that. So it, at a minimum, makes sense to take a look at it. And especially if you are in a rural area, where the funds are targeted for.
Great. All right. Well, Chris Emper, thank you again so much for being on the show. And listeners, thanks for making time to join us for today's episode of In Practice. Be sure to subscribe to this podcast on either Apple Podcasts or Spotify so that you never miss an episode. Until next time, thanks.